everyone. Thank you for listening in on this webcast. My name is Madeline Anderson. I am a new project coordinator at CPCA, and I'm specializing in health professions education and training. Today, I will be giving an overview of HRSA's Health Professions Education and Training Initiative. The goal of HRSA's Health Professions and Education Training Initiative is to enhance health centers' capabilities to recruit, develop, and retain their workforce by exposing health and allied health professions students, trainees, and residents to education and training programs conducted at health centers. This initiative is part of a $5.8 million grant from HRSA's Bureau of Health Workforce, and this grant was given to 52 state and regional primary care associations. As a part of this grant, primary care associations will provide training and technical assistance on the Readiness to Train and Assessment tool, a new survey that will help assess health professions training readiness, and provide strategic workforce plans to health centers. The HRSA HP-ET Initiative key players are HRSA, who provides guidance and funding for the initiative. And then we have Community Health Center, Inc., who created the Readiness to Train and Assessment tool and will provide technical assistance for the tool and analyze the survey results of the tool. CPCA, along with other PCAs, will provide support on the RTAT, or Readiness to Train Assessment tool, and will help you, health centers, develop targeted strategic workforce plans that will include health professions trainings and pipeline programs. And then we have regional consortia and health centers who are tasked with encouraging as many staff as possible to complete the RTAT survey. And then we have a few other collaborative partners, including health center controlled networks and national training and technical assistant partners. So what is the Readiness to Train Assessment tool, or the RTAT? The RTAT is a survey that assesses organizational readiness to implement health profession training programs. So the Rtac covers several organizational readiness dimensions relevant to all HPT programs and community health centers. The RTAT defines organizational readiness as the degree to which health centers are motivated and capable to engage with and implement a health professions training program. And then finally, as part of the post-survey, CPCA will use the RTAT results to create workforce training and technical assistant for community health centers. So more on the RTAT tool. The RTAT is a 41-item, 7-subscale survey that takes 15 to 25 minutes to complete. These 7 subscales measure organizational readiness dimensions that are vital for growing and developing health professions training programs. The first scale is readiness to engage. And then we have evidence and strength of quality for the HPT program. We have the relative advantage of the health professions training program, which includes stakeholders' perceptions of the advantage of engaging with or implementing the health professions training program versus an alternative solution. Then the RTAT looks at financial resources as well as additional resources for implementing health profession training programs. And then the RTAT finally looks at the implementation. So this subscale looks at the individuals involved in HPT implementation at the health center and their ability to influence HPT programs and overcome the implementation pushback or resistance. And then finally, the RTAT looks at the implementation plan. So the goal of this subscale is to assess methods for implementation that are developed in advance and the quality of those implementation methods. So it's important in terms of the RTAT to define what counts as an HP-ET program. So in terms of the RTAT, an HP-ET program is any formal organized education or training undertaken for the purposes of gaining knowledge and skills necessary to practice a specific health profession or role in a healthcare setting. This includes any type of shadowing, rotations, preceptor programs, as well as affiliation agreements and accredited or accreditation eligible programs, any educational and in any clinical discipline. Who should complete the RTAT? All health center staff are encouraged to complete the RTAT. In particular, CPCA recommends that staff who work closely with health professions, including HR, directors, C-suite staff like chief medical officers, residency program directors, faculty, and operational staff should complete the RTAT. And staff are also encouraged to connect with these key health profession players at their health center before taking the survey to fill in knowledge gaps and address questions. On September 23rd, CPCA sent out a link to all health centers to take the RTAT. CPCA requests that all health centers submit an RTAT response by February 2021 to be entered in a raffle to win a free 30-day job posting. After the survey results, CPCA can help you develop a targeted strategic workforce plan and provide training and technical assistance to achieve your overall workforce goals. So what are the benefits for community health centers when completing the RTAT? So the RTAT is a great first step in growing your own workforce. It also assesses your community health center readiness to engage in HPT growth and development. The survey will also collect baseline data to inform CPCA on direction for providing TA. And lastly, community health centers can improve their existing HPT programs by enhancing established academic partnerships and also targeting new potential trainees and training opportunities. So here is an overview of CPCA's role and commitment in regards to the HP-ET initiative. So in year one, CPCA will assign a program management manager for workforce development. We'll also provide T and TA for RTAT, and we'll also monitor RTAT completion rates. In year two, CPCA will analyze RTAT results, and based on those results, we'll develop workforce action plans and look into fostering new partnerships and enhancing existing partnerships. And then finally, in year three, CPCA will implement workforce action plans, disseminate evidence-based models and promising practices to community health centers, and demonstrate sustainability and return on investment. So here are some common RTAT questions. So who will track survey completion? Community Health Center Inc. will share survey completion rates with CPCA every 2 weeks. This information will be shared back with CEOs to assess the participation at their health center. The RTAT is open until February 2021. All health centers who participate in the RTAT will be entered into a raffle to receive a free job posting. And what happens with the results? So means from the survey will be calculated at 3 levels. Averages for each of the 41 items, averages for each of the 7 subscales, and then an overall average of the entire survey. Based on the overall mean score, health centers will be assigned as ready, approaching readiness, or developing readiness. These results will be used to create a targeted strategic workforce plan with CPCA's support. For more information on CPCA's HP-ET Initiative, please click on this link right here. We will also be holding RTAT office hours to answer your questions and concerns regarding the RTAT. So please keep an eye out for registration links to those office hours. If you have any questions regarding our HP-ET Initiative or the RTAT, please reach out to me, Madeline Anderson, at manderson@cpca.org. Thank you so much for listening in on this webcast. Look forward to improving our HP-ET initiative with you. Thank you.